We know that the pandemics cause significant economic, social, and political disruption. The likelihood of pandemics has seemed to be increased over the past century because of increased global travel and integration, which in turn increases the spreading and mortality rate too. So what about the olden days when there was low rate of global travel and integration? Maybe the chance of spreading would have been low, right? But what if I tell you that the most fatal pandemic recorded in the human history, taking the lives of millions, was of the 13th century, and it lasted for nearly 5 years? Keep watching to know more about this deadly pandemic. While pandemics that last for even less than a year have known to bring significant economic and social disruption, what and all would have been the adverse effect of a pandemic that lasted for nearly 5 years and was taking millions of lives? The Black Death, also known as the Pestilence and the Great Mortality, was the most fatal pandemic recorded in the human history, resulting in the deaths of up to 75 to 200 million people in Eurasia and North Africa, peaking in Europe from 1347 to 1351. The plague arrived in Europe in October 1347, when 12 ships from the Black Sea docked at the Sicilian port of Messina. People gathered on the docks were met with a horrifying surprise. Most sailors aboard the ships were dead, and those still alive were gravely ill and covered in black boils that oozed blood and pus. Sicilian authorities hastily ordered the fleet of the dead ships out of the harbor, but it was too late. The Black Death was the beginning of the second plague pandemic. The plague created religious, social, and economic upheavals with profound effects on the course of European history. The second plague pandemic is a major series of epidemics of the plague that started with the Black Death, which reached mainland Europe in 1348 and killed up to the half of the population of Eurasia in the next 4 years. Although the plague died out in most of the places, it became endemic and recurred regularly. A series of major epidemics occurred in the late 17th century, and the disease recurred in some places until the 19th century. After this, a new strain of bacterium appeared as the third pandemic. The Black Death most likely originated in Central Asia or East Asia, from where it travelled along the Silk Road, reaching Crimea by 1347. From there, it was most likely carried by the fleas living on the black rats that travelled on the Genoese merchant ships, spreading throughout the Mediterranean basin and reaching Africa, Western Asia, and the rest of the Europe via Constantinople, Sicily, and the Italian peninsula. Current evidence indicates that once it came on shore, the Black Death was in large part spread by human fleas, which caused pneumonic plague, and the person-to-person contact via aerosols, which pneumonic plague enables, thus explaining the very fast inland spread of the epidemic, which was faster than would have been expected if the primary vector was rat fleas causing bubonic plague. The Black Death was the second disaster affecting Europe during the late Middle Ages, the first one being the Great Famine, and this plague estimated to have killed 30 to 60% of Europe's population. In total, the plague must have reduced the world population from an estimated of 475 million to around 350 to 375 million in the 14th century. There were further outbreaks throughout the late Middle Ages, and with other contributing factors, it took until 1500 for the European population to regain the levels of 1300. Crisis of the late Middle Ages. Outbreaks of the plague recurred at various locations around the world until the early of 19th century. There are no exact figures for the death toll. The rate varied widely by the locality, and estimates are frequently revised as historical research brings new discoveries to light. Most scholars estimate that the Black Death killed up to 75 million people in the 14th century, at a time when the entire world population was still less than 500 million. Even where this historical record is considered reliable, only rough estimates of the total number of deaths from the plague are possible. Europe suffered an especially significant death toll from the plague. Modern estimates range between roughly one-third and one-half of the total European population in the 5-year period of 1347 to 1351 died, during which the most severely affected areas may have been lost up to 80% of their population. Because 14th century healers were at a loss to explain the cause of the Black Death, many Europeans ascribed supernatural forces, earthquakes, and malicious conspiracies, among the other things, as the possible reasons for the plague's emergence. No one on the 14th century considered rat control a way to the ward of the plague, and people began to believe only God's anger could produce such horrific displays of suffering and death. In most parts of Europe, it took nearly 80 years for population sizes to recover, and in some areas more than 150 years. From the perspective of many of the survivors, the effect of the plague may have been ultimately favorable, as the massive reduction of the workforce meant their labor was suddenly in higher demand. Those English peasants who survived found their situation to be much improved. For many Europeans, the 15th century was a golden age of prosperity and new opportunities. The land was plentiful, wages were high. A century later, as population growth resumed, the lower classes again faced deprivation and famine. The Black Death was terrifying, indiscriminately contagious. It could have even spread through the mere touching of clothes. The disease was also terrifyingly efficient. People who were perfectly healthy when they went to bed at night could have been dead by morning. Did you know? Many scholars think that the nursery rhyme Ring Around the Rosie was written about the symptoms of the Black Death. Meanwhile, in a panic, healthy people did all they could to avoid the sick. Doctors refused to see the patients, priests refused to administer the last rites, and shopkeepers closed the stores. Many people fled the cities for the countryside, but even there, they could not escape the disease. It affected cows, sheep, goats, pigs, and chickens as well as people. The plague never really ended, and it returned with a vengeance years later. While social distancing and isolation of sailors for 30 to 40 days helped in slowing the spread, but the plague's reappearance every few generations for centuries couldn't be stopped. Modern sanitation and public health practices have greatly mitigated the impact of the disease, but have not eliminated it. While antibiotics are available to treat the Black Death, according to the World Health Organization, there are still 1,000 to 3,000 cases of plague every year.